Hello, welcome to Physician Cognition's differential diagnosis platform. The objective of this video is to show how our differential diagnosis platform approaches headache, whether it is new onset or chronic. We also have a full platform and a differential diagnosis platform. The objective of having a differential diagnosis platform is to create intelligent differential diagnosis for a number of symptoms, signs, or lab abnormalities and take patient profile, past medical history, medication into consideration. Now, let me show you various functionalities of the user interface. Here we can type in any symptoms, signs, or lab abnormalities. If I can say headache, this is duration, this is qualifier. Qualifier is a high value information that is related to the symptom. Sometimes it can be used to replace a symptom. For example, if we choose new onset headache and submit, then the system automatically recognizes that it is a new onset symptoms and new onset headache, and the causes are different and the approach is different. Here you can see various contexts. Example, headache in an immunocompromised or headache after trauma is different. So here you can see history of recent trauma, immunocompromised, or even recent travel to West Africa, etc. So let me show you how it works for some of the common primary headache syndromes. Let me put headache. And the qualifier here, let's say severe disabling headache lasting for 4 to 72 hours, unilateral pulsatile in person with activity, with nausea, vomiting, or photophobia. In the second screen, you can see some of the associated symptoms that the system is seeking. This is designed as automatically captured from the electronic medical record. If we answer all those, the result will be better, but we can actually do quick look and get to the differential diagnosis right away. You can see migraine is being considered right there as number 1 and 2. It's also considering other symptoms, other causes here, because the objective of the differential diagnosis platform is to make sure that we are not missing anything. We do have the capability of getting to the final diagnosis by itself. Let me show you another example. Headache, photophobia, say nausea, and vomiting. So instead of typing in qualifier, we can simply type in the symptoms and quick look, and the number 1 diagnosis here the system is considering is migraine again. Here it can give some inferences. A diagnosis of migraine is highly likely with this combination, etc. It's also considering other options, like I mentioned. If we add any more information, it will change the differential diagnosis. Example, if I say a patient has say leukocytosis in CSF, then the diagnosis is obviously different. It's meningitis or meningoencephalitis. So it has changed the diagnosis here. So let me go back. If you click on diagnosis, it will go back to the home page again. I also want to show you some of the capabilities, say new onset headache, for example, and with a context. Example, headache interrupts sleep or start immediately upon awakening. That context. So with that context, it's considering space occupying lesions or hypnic headache. It's also giving some inferences. It's asking for CT brain with that high value information as a context. So next, I would like to show you some of the cause of secondary headache, say blurring of vision and headache. For example. And then the system is considering the most common causes of blurred vision and headache, which could be something local related to the eye, refractory errors, etc. It's considering stroke and TIAs because the patient is 60. Let's go back, and I'll also show you another example, headache, new onset headache, and go to qualifier and we'll say sudden onset worst headache of life. System would consider subarachnoid hemorrhage, and it's asked inferences say that computer tomography should be performed before lumbar puncture. It's asking for CT brain and also CSF xanthochromia. These are other high value information. If it is present already in the electronic medical record, it takes that information into account. So another example I would like to show you is how headache is new onset headache is different in patients with, say, past medical history of malignancy. New onset headache in a patient with a history of malignancy. You can see it's considering like space occupying lesion. It's asking for CT brain with contrast, etc. So sometimes the system keeps the past medical history unless we change the patient. So I'm just deleting that from the past medical history here. Now I would like to show you some more context-based examples. Say new onset headache, patient with non-immunocompromised status, has worsened over the last few days, interrupt sleep upon awakening. So submit. So multiple contexts here. So in the case of multiple contexts, it's considering infections, meningitis, cryptococcal, the space occupying, toxoplasma, etc. And then the system has identified this patient has a high risk category and need imaging of the head. So it's asking for CT brain. So some other examples, say headache, fever, and neck stiffness. The answer here is obvious. Just wanted to show how it works. So it's considering meningitis and encephalitis. It's asking for CSF analysis, culture blood, etc. Number one is it's looking for leukocytes in CSF here. So let me also show you some of the other examples. Say headache, weight loss, and loss of vision. This is a 60-year-old patient. System is considering benign intracranial hypertension, giant cell arteritis, etc. That's number one, and it's asking for temporal artery tenderness. So I just wanted to show another example of say rare causes here. Headache with the context of recurrent headaches that are very short duration, usually 3 seconds or less, does not have characteristic of any other type of primary headaches, for example. And it's considering primary stabbing headache. It's a rare cause, but it's considering that. And then another example is headache, say weight loss, and clubbing, for example. Now the patient might have malignancy based on clubbing and weight loss and headache. The system is considering lung cancer or metastatic brain disease. Or other examples, chronic headache, or say new onset headache in certain age group. new onset headache in a 60-year-old man, the context of new onset severe headache not attributable to local infections. So it's a new onset headache, severe headache in a 60-year-old man, and the system is asking for a CT scan here. It's also saying that patient might be under a high risk category. So that's how it works. Headache, projectile, vomiting, in the context of headache triggered by cough. And it's considering space occupying lesion. And probably the last one more example of chronic headache here. Chronic headache with context of headache triggered by cough, for example. Thus, if you look at the inference, it's saying that patient needs neuroimaging. It's considering space occupying lesion, Arnold Chiari malformation, primary cough, headache, etc. It's also saying that patient needs neuroimaging prior to making diagnosis of primary cough, headache. So these are some of the examples of how it works. It's rated a past medical history combination. The reason why it is not getting the final diagnosis at this point is because the objective of the differential platform is to create an intelligent differential diagnosis. Hope this helps. Please contact us if you have any questions. Thank you very much for your patience. Have a good day.